A very good evening, all of you. How is your studies going on? Are you revising the things? Which subject are you revising? Please comment in the chat box. So today we are going to study surgery MCQ challenge. Well, these MCQs are quite important. Surgery is a very important branch as far as NEET PG is concerned or INSCT is concerned. It has a very good weightage of almost 30 to 35 questions come directly from surgery. And if you have mastered this subject, it will be very easy for you to get those 35 questions correct. So let's move on to the first question. Most common cause of small intestine obstruction is A. Intussusception, B. Idiopathic adhesion tumors, C. Tumors, D. Postoperative adhesions. So what do you think is the correct answer? Most common cause of small intestinal obstruction. What do you think is the correct answer here? Anybody, please. Most common cause of small intestinal obstruction. A. Intussusception, B. Idiopathic adhesions, C. Tumors, and D. Postoperative adhesion. And the correct answer here is postoperative adhesions. Postoperative adhesions. Cox peculiar tumor. Cox peculiar tumor is A. Basal cell carcinoma, B. Squamous cell carcinoma, C. Ulcerated sebaceous cyst, D. Cylindrome. Most common cause of small bowel obstruction is, we have seen that it was post-surgical adhesions. Now the second question, Cox peculiar tumor is A. Basal cell carcinoma, B. Squamous cell carcinoma, C. Ulcerated sebaceous cyst, D. Cylindrome. The correct answer here is it is a ulcerated sebaceous cyst. It is not squamous cell carcinoma, it is an ulcerated sebaceous cyst. Cox peculiar tumor is a sebaceous cyst linked growth that can resemble squamous cell carcinoma, but it is not squamous cell carcinoma. The proliferating cyst is usually solitary, but it often arises from the simple tricholemal cyst and the hair follicle epithelium. So the correct answer here is ulcerated sebaceous cyst. False about gastric lymphoma is A. Stomach is the most common site. B. Associated with H. pylori infection. C. Total gastrectomy with adjuvant chemotherapy is treatment of choice. D. 5-year survival after treatment is 60%. Now, let us know something about the gastric lymphoma. Stomach is the most common extranodal site of lymphoma. It is of two types, primary lymphoma, secondary lymphoma. Primary gastric lymphoma is a lymphoma of stomach which exhibits no evidence of liver, spleen, mediastinal node, or bone marrow involvement at the time of diagnosis. Regional lymph node involvement may be present. Primary gastric lymphoma is mainly 95%, that is more than 95%, non-Hodgkin's lymphoma of B cell origin. Most of the primary lymphomas, about 60%, arise in the MALT, that is mucosa-associated lymphoid tissue. MALT is usually associated with chronic H. pylori infection. So low-grade MALT lymphoma are thought to arise because of chronic H. pylori infection. These low-grade lymphomas may later on degenerate to high-grade lymphomas. Immunodeficiency and H. pylori infection are risk factors for B-cell lymphoma. Most common site of involvement is the gastric antrum. So the correct answer here is total gastrectomy with adjuvant chemotherapy is a treatment of choice. Please click the link in the description box to join the 2-day Neet PG Breakthrough Blueprint Masterclass. It will be covering all the 19 subjects in a holistic manner, and it will give you a blueprint for your preparation way forward. So please click the link in the description box to join. It is completely free. Which one of the following preservative is used while packing catgut suture? A. Isopropyl alcohol. B. Colloidal iodine. C. Glutaraldehyde. D. Hydrogen peroxide. It is isopropyl alcohol. Primary hyperparathyroidism, pheochromocytoma is associated with which type of thyroid cancer? A. Medullary thyroid carcinoma of thyroid. B. Papillary carcinoma of thyroid. C. Anaplastic carcinoma of thyroid. D. Follicular carcinoma of thyroid. It is medullary carcinoma of thyroid. Please click the link in the description box to join the free Ultimate Neat PG Breakthrough Blueprint Masterclass. The first 10 people who click the link in the description box will get the class absolutely free. So let's Meconium ileus is associated with A. Cystic fibrosis, B. Infant of diabetic mother, C. Hypothyroidism, D. None of the above. So the correct answer here is cystic fibrosis. Well, the cystic fibrosis is a very important topic as far as pediatrics is concerned and medicine is concerned. Which of the following nerve is commonly damaged during McBurney's incision? A. Subcostal nerve, B. 10th thoracic nerve, 11th thoracic nerve, C. D. Iliohypogastric nerve. It is iliohypogastric. Dysphagia lazoria is due to A. Esophageal diverticulum, B. Aneurysm of aorta, C. Esophageal web compression of aberrant blood vessel. It is compression by aberrant blood vessel. Surgery for undescended testes is recommended at what age? A. 6 months, B. 12 months, C. 24 months, D. 36 months. It is 6 months. Click the link in the description box. Dacron vascular graft is A. Textile biologic, B. Textile synthetic, C. Non-textile biologic, non-textile synthetic. It is textile synthetic. What is the most common position of appendix? It is retrocecal. Double bubble sign is seen in A. Duodenal atresia, B. Duodenal stenosis, C. Volvulus, D. R. Curling ulcer is seen in A. Burns patient, B. Patient with head injuries. In patient with head injuries, Cushing ulcer is seen. Curling ulcer is seen in Burns patients. The correct option here is Burns patient. All are true about amoebic liver abscess. A. More common in female, more common left lobe of liver. Metronidazole mainstay of treatment, except it is A and B. Indication of liver transplantation are all biliary atresia, sclerosing cholangitis, hepatitis A, cirrhosis. Except hepatitis A. In hepatitis A, you don't do the liver transplantation. Care sign is seen in splenic rupture is A. Pain over left shoulder, B. Pain over right scapula, C. Periumbilical pain, D. Pain over rear angle. It is pain over left shoulder. Breast conservation surgery is not indicated. A. Large pendular breast, B. SLA, C. Diffuse microcalcification, D. All. It is all. Mondo's disease is Mondo's disease is Mondo's disease is A. Thrombophlebitis of superficial veins of breast, B. Carcinoma of breast, C. Pre-malignant condition of breast, D. Filariasis of breast. So the correct answer here is, what do you think is the correct answer? Please mark in the comment box, please. Mondo's disease is, well, this is a common MCQ repeatedly asked in the NEET PG exam. So the correct answer here is Mondo's disease. Thrombophlebitis of superficial veins of breast. Lateral aberrant thyroid refers to A. Congenital thyroid abnormality, B. Metastatic focus in lymph node, B. Struma ovary, C. Struma ovary, D. Lingual thyroid. Lateral aberrant thyroid. Well, it is a metastatic focus in the lymph node. Lateral aberrant thyroid is a metastatic focus in the lymph node. Most common site of CA esophagus is A. Middle one third, B. Upper one third, C. Lower one third, D. Lower end of esophagus. It is middle one third, which is the most common site of CA esophagus. In this way, they can ask about the most common site of different cancers. Corkscrew esophagus, a very important repeated question is this. In which of the following condition? A. Carcinoma esophagus, B. Scleroderma, C. Achalasia cardiac, D. Diffuse esophageal spasm. Without thinking anything else, it is directly diffuse esophageal spasm. You should click the right answer correctly. Now let us move to the next question. The most common type of tracheoesophageal fistula is esophageal atresia without tracheoesophageal fistula, esophageal atresia with Brockman. So what is the correct answer here? It is esophageal atresia with distal tracheoesophageal fistula. The best investigation modality for gallbladder stones is, again, gallbladder is a very important topic. A. Oral cholecystogram, B. Percutaneous transhepatic cholangiography, C. Ultrasound, D. Intravenous. It is ultrasound. Strawberry gallbladder, we all know it is cholestasis. Correct answer is cholestasis. Viapoma is associated with Werner-Morrison syndrome. All are resected in Whipple's operation except neck of pancreas. You don't dissect the neck of pancreas in this Whipple's operation. The tendency of colonic carcinoma to metastasize is best assessed by A. Size of tumor, B. Carcinoembryogenic antigen levels. Then depth of penetration of bowel wall, proportion of it is the depth of penetration of bowel wall. Commonest cause of intussusception: A. Submucous lipoma, Meckel's diverticulum, hypertrophy of submucous pair patches, D. polyp. It is hypertrophy of submucous pair patches.